Welcome to the Enlightened Pet Behavior Podcast. I'm your host, Susan Light. In a world overflowing with conflicting advice and often misguided information, my mission is to be your trusted source for accurate, kind, and truly effective strategies to understand and shape your pet's behavior. Join me as we shed light on common challenges and work to foster a deeper, more harmonious bond with our beloved furry family members. Today, we're talking about what to do if your cat isn't using their litter box. But before we start, if you find the show helpful and enjoyable, please consider showing your support by subscribing, following, rating, reviewing, and sharing with your friends. It just takes a minute, but it really boosts the show's visibility and helps more pet parents find it. Thank you so much for your support. Joining me today is a superstar of the veterinary behavior world. This is her second time coming to talk to me, and I'm so grateful. She has served on the Fear Free Executive Board, AAHA Behavior Management Task Force, the Kindred Biosciences Advisory Council, and she is finishing up her term as president of the American College of Veterinary Behaviorists. Please welcome Dr. Lisa Radosta. Awesome. So, this is actually also the first cat episode because, yeah, the show was exclusively dogs for the first couple of years. So, we're going to talk about litter box issues, which I feel like, am I wrong? Is that like most of the reasons cats come to see you guys? I feel like it's a super prevalent issue
Well,
to reach out for.
it's still the most common as far as we know cat behavior issue, but it is one that a lot of primary care veterinarians are solving.
Oh,
Um,
great.
because we've been talking about it for so long. It's been the most common cat behavior problem for so long that a lot of primary care know how to take care of it. So we are seeing more aggression in the referral services. We're seeing more aggression for sure. No.
Well, that's great. So then people should have more hope when they see their primary care vet. So you said that the primary care vets can handle it. So what is the most common reasons uh, that cats are eliminating outside? I think we don't call it we used to be called what, improper elimination or something, and we're not calling it that anymore, right? It's just eliminating outside the litter box. A little bit
Yeah, so
less
we used to
judgment.
call yeah, we used to call it inappropriate elimination, and you'll still find that in some textbooks, and you might still hear veterinary behaviorists or animal behaviorists calling it that. So it's not that you're not ever gonna hear that term. I think a lot of us are moving away from the term because it's inaccurate. Right? Because it's not inappropriate to the cat. Cats are not born with the innate need to use a litter box. That's something we taught them. So it's not necessarily inappropriate that they would choose not to go there, right? So we choose words like either just descriptive, elimination outside the box, or on our service, we use periuria and perichesia. And the reason that I use that is not to make life more complicated, but I am forever, if you follow me on social, you know I'm forever pounding out that behavior and medical are not separate. And I think as soon as we call behavior problems something different, then they're different. And it's not different. Periuria is peeing all over the place. Perichesia, same. So if we call those behaviors those words, maybe I can just convince more veterinarians and more pet parents that it's all one thing. It's behavior and medical is just one thing.
Yeah, absolutely. And it's a very common reason for cats to be surrendered because it's very difficult to live with a cat that is peeing all over your house. Believe me, we sympathize. It is not a fun problem to be living with. So, what are the common reasons? I know you said we can't separate medical from behavioral. So I don't know if you want to talk about medical first, maybe, or behavioral first, or just
Well, I think we can approach it from what do we do? Because that's where the reasons come from, right? So because you do certain things because of the most common reasons. So what are the things we would do? We would look at the environment. So environment's a major reason. And I just posted recently on my socials that the right number of wrong boxes is still wrong because for so long we being the behavior community have preached to veterinarians and to pet parents, you need n plus one boxes with n being the number of cats in your household. But that isn't necessarily true. What is true is you need the right size, style, and number of boxes,
and
or-
location.
right? And location and litter for those cats. And if you just put 4 boxes for 3 cats, but one of the cats doesn't feel those boxes or those types of boxes are adequate, you could have a cat that eliminates outside of the box. So I'm trying to modify our message. Yes, in a perfect world, you could get 4 boxes for 3 cats and you might be okay. You probably will be okay. But for the cats that have preferences, you will need to find what that cat likes, right? Fulfill his needs. So environmental. Another challenge, especially with perichesia, which is the defecation outside the box. So another big reason is pain. Huge reason. So looking at 4 studies, which are usually done randomly. So for example, let's say a radiologist will pull 100 random cat x-rays. So they don't know anything about these cats. They work at a university. They pull 100 x-rays. So there are 4 studies kind of done in about that way, and it looks like anywhere from 25 to 92, that is a huge number, 92% of cats have osteoarthritis. So of those 4 studies, there's 1 at the 22%. The rest of them are in the 90%. So 3 are telling us and these aren't cats who are 20 years old. So a lot of cats are painful, a lot of vets and a lot of pet parents are missing it. Pooping outside the box, in my experience, almost always equals pain. The pain could be constipation, which is very common in cats, okay? But some sort of pain or discomfort is what I'm gonna hunt down. Then we have social stressors, because cats aren't built to live together if they're not related. Related cats live together. Anybody's had a barn knows, right? Related cats live together, they eat together. But when they're not related, they might come together around a big bowl of food in the barn, but then the related ones disperse into colonies. Well, what we do as cat pet parents is, they're like M&Ms. You can't have just one. You got to have a bunch of cats. And so it's pretty expected that some cats are not going to get along. And when that happens, we see cats leaving the box for all kinds of reasons related to that. Like maybe one cat blocks the box, or one cat um, kind of lies in the middle of the hallway and all the boxes are at the end of the hallway. So the other cats can't get through. So those are kind of our big causes: pain, and medical illness, the wrong litter box environment, and the wrong social environment.
Yeah. Um, and that's why we suggest N+1 litter boxes, because the more you have, the less likely that a cat can be blocked from all of them. Right. So,
Right. Right. And so
this
we
this come from somewhere, these recommendations.
yes, and that N+1 comes from, like, it's almost like Moses with was it Moses that had the commandments? Somebody had the commandments, right?
Yeah.
So right, we don't know where N+1 came from. We've been repeating it, no lie, for 30 years. And it works most of the time, and that's really great. But what I want people to do is think of real estate. How much real estate do you have? So if you have cats that are, let's say, 15 pounds, which is a pretty average cat, 13 to 15 pounds, and your boxes are standard litter boxes, 16 by 20 inches, and you have 4, they're wrong. I don't care that you have 4 for 3 cats. They're wrong. They're too small. So I want you to think of real estate, because let's say you scoop the box twice a day and you have 2 cats and 3 boxes. Those boxes are gonna be soiled, all 3 of them, in between when you scoop. And if you have a lot of real estate, so if you have a lot of, big boxes, then even if it's soiled on the left side, the cat can still get on the right side and find a clean spot. So the large size is just as important as the number. And also, one study, this is probably a decade old, looked at covered boxes and uncovered boxes in a unique way, because we tell people cats don't like covered boxes. But what if you give a cat a very large box? Then do they care if it's covered or uncovered? The answer based on that study is no. So again, I go back to real estate, real estate, real estate. Cats need space, not only to get away from poop that you haven't had time to clean up, but also to position their bodies in such a way that they can dig a hole, step over it, urinate or defecate, turn around, and cover. That's a fair amount of space for a regular sized cat.
And this is where I think that the industry has sort of not the behavior industry, but like the pet care industry has really failed because if you go to the pet store to buy a litter box, I have yet to see something marketed as a litter box that is big enough. All of my litter boxes are under the bed totes.
Mhm.
They're like those big, shallow, and I do know some people like to do the deep totes and then like cut a little door for them. I find the under the bed totes are ready to go because they're a good depth and they're huge. But we say, you want it to be the one and a half length of your cat. And I mean, I've had some big cats and they're just not big enough, those boxes that they sell. So, and those under the bed totes are way cheaper. Your litter box is going to sell for 20 bucks. I've paid 7 at Target for that. Like,
I know, I know. So I've also kind of revised how I teach people to find the right box because I said just what you said. For many years, I said 1.5 times the length of your cat. Then there was the question, does that include the tail? Well,
mm,
how long is that right? So all these questions. So I said, okay, let's hang on. I want you to measure your cat from the nose to his butt. So we're not going to include his tail. Okay. And I want you to take that and you're going to multiply it two different ways. You're gonna take that number times 2.5, and that is the minimum size of the long side of your box. Then you're gonna take that number and multiply it times 1.5, and that's the minimum length of the short side of your box. Because my observation from watching cats urinate and defecate a lot on video, because a lot of my clients have poop and pee cams, and I also watch my cat. I'm sure he thinks I'm crazy. I'm like sticking my head around the corner and he's pooping. But I think that a more square box is probably better. So for my cat, because he's long, he's more like an 18-wheeler truck. And so he needs a lot of space to make the turn to get in position, right? So he needed a more square-ish box. So I went down to Lowe's and got like a mud mixing bin. It's a black rubber tub and you like garden with it and mix your garden soil and your fertilizer. And that was just right. So I used to use the under the bed storage boxes for 30 years. I've used those boxes. But one day I watched him and he stepped out with his back legs to reach in and cover because he couldn't get his body in there. So I thought, dude, this is not okay. So that's when I got the mixer. So I ask people, watch your cat pee and poop. What's happening there, right? That's good anyway. You watch your dog pee and poop every day, right? Watch your cat. He should get right into the squat position. There should be no skin crinkling, no straining. And when he goes to the bathroom, when he gets in position, something should come out. A lot of cats who urinate and nothing comes out, and nobody knows that. We watch them on video, right? That's not normal. That's a trip to the vet. And watch to see if he slips out to cold. That means his box needs to be more square and less right.
yeah, that's a great tip. And let's talk about litter robots.
Yeah.
Because they're very popular and all over social media, everybody's talking about them. And I get tired of commenting on their posts like, "Don't get it, don't get it, don't get the litter robot." What's your opinion on 'em? And I know there's more than one, there's a bunch of them, so
Oh, there's so many, right? So this is what I was saying years ago, and we told people do not buy those because they were loud and they weren't sensitive enough that they would wait until the cat was fully out of the box and they would scare cats and we'd have elimination problems. Now, what I would say is, wow, technology's come a long way. And so it might be okay for your cat. But here's what I would say to try to see if it's to your cat's liking. And the way that you do that is not to remove the option you have and replace. You don't remove and replace. You add, knowing full well that whatever that costs, I don't know, 150, $200, I don't know what it costs, right?
500,
No. Okay.
500. Oh, yeah.
Okay. My plastic box from Lowe's was $17, but okay.
I know, I don't see the appeal, people don't wanna scoop, I guess.
Right. So let's just say, what if you're an overnight nurse and you're gone 15 hours? Let's say that. And she's worried about that. So she goes in, she gets the robot. You have to add it to see if your cats will use it because cats sometimes go right to it and sometimes they are kind of scared of it. So if your cat likes it, more power to you. But if your cat doesn't like it, keep your receipt and just return it. Yeah.
Yeah. And also, when we were just talking about size, those are huge, but the part that your cat stands on is so small, which is another problem for a lot of cats. But I do know cats that use them and they do use them and they don't have problems. So
Yeah.
it can't.
I think that you have to be I think we have to approach this from the standpoint of fulfilling your cat's needs. And I understand the allure of a litter robot or whatever they're called, whatever brand you decide to get. Because if you do work long hours, you want your cat to have a clean lot. But if it's not going to fulfill your cat's need for size or for litter, because you can only use certain litters with them, then it's probably not the best thing for your husband.
Actually, that was my next question. Uh, do you tend to recommend people trying different types of litter? Do you see cats being aversive to certain types of litter?
Most certainly, cats are aversive to certain types of litter, and I think most of us have cats who will use whatever litter we put in the box, right? Like, but for those of us that have cats who are sensitive to certain substrates, scents, I do want people to try different litters, but it's the same concept that we just talked about, where you would add. So people will say, I want to do what we call a litter box buffet, which is great. You're going to keep your current boxes. So you have 3 cats and 4 boxes. You're going to add an additional box that is identical to the ones you have. And you're going to add that litter. And you're going to scoop it the way you always scoop your boxes, but you're not going to change out that box for 2 weeks because cats sometimes are slow to adapt, right? And you might find that some of your cats will use that litter and some won't. So we may need to put different litter in different boxes. It's really about preference.
Mhm. And that's the thing to know too is I would say it's not a problem until it's a problem. Sometimes you can get away with things. I mean, I had 2 cats in a studio apartment when I first moved to LA. We had 1 box and we got lucky, right? But now we've got 3 boxes now that we have the space. So, but I will say sometimes when something goes awry, maybe health-wise or stress-wise, that's when you're going to start seeing those problems show up where you got away with having the less than ideal setup, I
That's
find.
exactly right. That's exactly right. When cats are stressed, they pee and poop outside the box. When dogs are stressed, they have diarrhea. Like everybody has their thing. But absolutely, if there's one little kink in the system, if there is an illness, it really elucidates that problem in your litter box system. Yeah.
Yeah. So you said, if they're squatting in the box and nothing comes out, that's a trip to the vet. And for boys, it's like ER trip. It's not even call your vet, right?
You
Boys,
got
it's
it.
like
That's right. I mean,
like straight to the vet.
urine is supposed to come out, especially for boys. And keep in mind, I know that a lot of kitties that I see are come into me already on Prozac, which is a good drug. Fluoxetine is the generic, if people are thinking, what drug is that? Um, Now, any drug that affects serotonin, that's Prozac, which is fluoxetine, Paxil is paroxetine, sertraline is Zoloft, what Clomicalm is clomipramine, trazodone, even venlafaxine. So any of these drugs can cause urinary retention to the point where your cat will not urinate potentially for days. That's not to say that I don't use these medicines. Of course I do. But every single client who gets one of those medicines or any medicine that affects serotonin hears your cat must urinate twice a day and poop once a day. If that doesn't happen, I tell them stop giving the drug. The first thing you do is stop giving it. Don't wait to call me. Just don't give it. And if your cat stops urinating, or defecating, you have to go to the vet. So most of my clients, if they see a decrease in that urination from 2 to 1, will stop the drug, but not every client. I've had 2 clients, one, who waited 3 days, her cat had didn't urinate for 3 days because she was afraid to stop the drug abruptly, and then the other client, her cat had gone from 2 urinations a day to 1, and, her cat had gone from defecating every day to defecating every couple of days. This was a cat who was put on fluoxetine in the primary care, and then when I saw them, I took her immediately off. So we wanna be careful. These are great drugs, yes, but anything can cause a side effect, so we wanna be careful with that.
Yeah. Is that just for cats? Because I've never heard that as a side effect for dogs.
So that is interesting, right? Because they've got the same neurons. So, because there's node, right? You can't see, but right at like the near the LS junction where so nerve endings come off that innervate the bladder. And that's the node that we think is affected by these SSRIs and SNRIs. But I have not seen it in dogs. I have never had a client report it in dogs. Now, there's another drug called Clomicalm, which is clomipramine, which cats and dogs are on. That drug is a tricyclic antidepressant, and that drug will cause some urinary retention and fecal retention, not as a side effect, as an effect. Okay, so that's part of what the drug does. But those animals don't seem to get blocked or have constipation, and that is in dogs and in cats. Whereas the SSRIs, selective serotonin reuptake inhibitors, we do see, I'm going to say, I'm use doctor terms, not uncommonly, whatever that means. We say it all the time, not uncommon. We see urinary retention in cats with those SSRIs. Yeah.
Wow, that's fascinating. So, if your cat goes outside the litter box, is that an immediate trip to the vet, or should you start by looking at your environment and trying some things?
Yeah. Cats and dogs, and horses and bunnies and birds are voiceless. And so to me, if something's wrong, you should go to your vet. But what you do at your vet, more and more, I feel like we have to advocate as pet parents. And I am not putting vets down because I see the industry from the other side. I see the corporate ownership of practices. I see the pressure put on veterinarians to practice in a certain way. I have many friends who either are relief vets now, mobile vets, or left the profession. So I'm not putting vets down. I'm saying that as a human being, when I go to the doctor with my mother, I know I must advocate for her. And I think we're at a pivotal point in vet med where we need to do that. So if your cat urinates outside the box, what do? You bring your cat to the vet and you make it clear that you want a medical workup. What is that for a cat? That is a CBC, which is red blood cells and white blood cells. That's a chemistry, which is abdominal organs, a thyroid, a urinalysis. What is shocking to me is how often I receive these cases into my service and the workup has not been done. It has to be done. The urinalysis is hard to do on a cat, for God's sake. Cats don't pee in the cup like the dog does outside. And we used to use plastic litter. It doesn't work. Cats don't use it most of the time. So that means your cat has to go to the back of the hospital, or if the veterinarian has a mobile ultrasound, the ultrasound should be brought to the exam room because your cat should not leave you unless it's a necessity. And most ultrasounds have wheels, and you just plug them in. So ask for that ultrasound to come to you unless you're squeamish about needles, and they will use a needle to take the urine from the bladder. It's called a cystocentesis. What is shocking is that the cats don't move. I mean, I think if someone stuck a needle into my abdomen, I would flinch, but they don't. And that is almost the only way. It's not the only way, but it is the most common way that we get urine. So we are looking for not only infection, right? We're looking for blood because there's this thing called fluted, feline lower urinary tract disease. Some doctors call it FIC, feline idiopathic cystitis. And it's kind of a Pandora's box, but we diagnose it. We start with a sterile urine, we do a culture on it. If there's no infection and there's blood, and we think the blood is real because when you put a needle through the body while you might
There's a tiny bit of blood, right? Yeah.
right, right. So you think the blood is real, then you know that you are on a track for fluted. You have to first prove that the cat doesn't have stones, bladder stones. And once you've shown that with an X-ray and you have blood, now you have this fluted. So what is that? That means the bladder's bleeding, my friends. That is no bueno, okay? That hurts and it's not healthy. And what causes that? Well, no one knows exactly all the causes, but we do know from some studies done at UC Davis that those cats have higher circulating, we'll call it adrenaline, right? Their activating neurotransmitters are higher when they are bleeding into the bladder. So we really want to be attacking the stress level in the house. And some pet parents are listening to this and going, there's no blood in the urine. I don't see it in my litter box. You're not going to see it. It's microscopic. Like I could even hold your cat's urine up in a urine tube, which is clear, and it might look yellow. These are microscopic, right? You're not going to see those red blood cells unless you got a microscope. So we really want to do that full workup. And sometimes you're going to do that and you're going to get out of that, besides a bill, you're going to get a peace of mind. But a lot of the time, in my experience, I'm going to find some problem that I need to treat. And we want to be identifying those because we don't want unnecessary suffering in our kitties, you know?
Yeah, it's my one of my cats, a year and a half ago, peed outside the litter box, and we took her to the vet, and that's how I knew about the needle, and he was like, "There was a little bit of blood, but I think it was from sticking the needle in," and the only thing that they found wrong with her was and they did X-rays and the full workup and everything, was a slightly elevated body temperature. So, but nothing that showed up in the blood work for infections. So we gave her a round of antibiotics and she was fine. So, that was fortunate that it ended up that it was, but like it was a very small tell. He's like, I can't see an infection on the blood work, but she has a slightly elevated body temperature, so she could have an infection. So we tried that and it worked out. So, it is and I think it was $1,200 visit to the vet. But again, I would much rather do that and hope it's medical and treatable. Because boy, if we start to go down this behavior road, it takes a lot longer sometimes, right? So let's talk about that. So we want to do medical first. If hopefully that's what it is, hopefully we can treat it. Say all of that comes back normal, then we think maybe it's behavioral. What would we start with?
Yeah, so I wanna mention one more thing. If the cat is declawed, and I understand probably most pet parents that listen to this wouldn't ask for a declaw, but cats are still being declawed. So you could have adopted one from a rescue or from a shelter or from a breeder. The cat I saw recently was adopted from a breeder as an adult, and the pet parent found a veterinarian that was willing to do a declaw. I had to, like, read the medical record 3 times because I was like, "No, I don't think that what? Is that right?" So, if you have a cat that was declawed, there's about 85% of those cats are painful. So, you know, um, there's that. We have a problem, right? So there's that whole part of it. But what are we going to do? Then we're gonna examine the litter box environment. Poop and pee cams are fantastic. Cameras are so cheap now, and there's plenty that you can buy that connect to an app that will be motion activated, right? So seeing, for example, as a cat that was brought to me, a little tabby floof, like medium domestic care, and so, with a 4-year history of defecation outside the box, 4 years. The cat had also urinated outside the box, but what the pet parents did was they picked up everything soft that they could. They closed the doors to the rooms he was urinating in, and he had done fine. So, by the time I saw him, he was still defecating outside the box every single day. So these brilliant pet parents brought me videos, and the videos are so cute. I don't know, cat pooping is sort of cute. I don't know. Well, they put the camera on the floor, so I'm seeing these cat feet, and the poop falling. That poop was, so if you have a cat or a dog, you gotta go online and get the Purina fecal scale because that you search it and it's visual. So that cat was a 1, fecal score of 1. They were hard, like
Like
olives. I
rabbit
could hear them
pellets?
plunk on the floor, plunk like through the camera. So I said to them, "Okay, well, your cat's constipated." So before we made any litter box changes, we started the cat on canned food. Cats need canned food. We started him on Hydrocare, which is a Purina product that you put in a bowl. You can put it on their food, but I put it in a bowl, and they drink it, and it increases water intake by about 50%. We just did that. 4 weeks later, he was defecating outside of the box once a week. So from once a day to once a week. At that point, I added a little bit of Miralax. So we look at the cat urinating or defecating if we can. Then we look at what is the environment? How many boxes do you have for your cats? Are they the right size? We do the 2.5, 1.5, like I talked about earlier, right? And where are they in the home? Can your cat easily get to them? A lot of times people will say, well, Dr. Radosta, I've had the litter box upstairs for 2 years. I don't understand why that would be a problem now. Well, because cats age and they might be
Stuff changes. How's
stuff changes. Oh my god, I'm 56, stuff changes, okay? So, yeah, so we look at that, we make sure we have the right size of boxes, the right number of boxes, they're spread around the house. We look for anything recently that may have changed. Maybe the pet parent changed the litter, we try to change that back. Maybe they have some foster kittens in the bathroom, right? We try to look at things like that, and then we try to look at social interactions. I don't usually ask people like, do your cats fight? Because I think when we think of fighting, we think of the cat brawl like you might see in a cartoon or something. But, there's a lot of microaggressions in the cat.
cats are subtle.
They are so subtle.
Oh,
Yeah.
yeah.
Yeah, body blocking is a big one, blocking access to certain areas. And you might not see the cat blocking. You might see the other cat taking a very wide berth, right? So if there's any kind of arguing going on there, then we have to also address that. And then there is a place for the use of medicines and different foods and different supplements to try to alter the stress level. Because let's say, here's an example. So, one of my clients takes care of her mother's cat. Her mom is in assisted living. And this cat, as you can imagine, to an elderly person who's given up her home, she's a widow. This cat is very important. This is all she has. Her daughter lives about 2 hours away. That's my client, is the daughter. And so this kitty eliminates outside the box. The the mom has dementia. She can't remember to clean the box. The people in assisted living will help her once a day. It's kind of a mess. So we do use a medication in that cat to kind of increase the cat's tolerance for the world in which she lives. And some people out there might say that cat should be rehomed. I don't know. I don't when I'm 85, don't I almost wanna cry right now. Do not rehome my don't take my pet from me. Like, "Oh my god."
Also, like, there's a million homes waiting to take these cats in. People say that, like, we're not killing cats in shelters every day who don't have homes.
So many cats.
Yeah, if we can keep them in their homes, we need to keep them in their homes.
Yeah,
Yeah,
agreed. Yeah.
yeah, totally. Wow. So, how long should it take to see a result? How long do we wait? Should we see progress before we're like, okay, I don't think this was it. We need to look maybe further.
Yeah, so if we're talking about changes to the environment, so we're not talking about food or medicine, changes to the environment, you could see a change immediately, but I try to give cats 2 weeks to adjust. And so I tell people we'll make 1 to 2 changes this week. In 2 weeks, well, if you see it's kind of like an algorithm. They'll check in with us and I'll say, "Okay, what happened?" And they'll say, A happened. And then I'll say, "Okay, that will lead us to B." Or they'll say, C happened. I say, "Okay, that will lead us to D." So it's really trying to figure out the needs of someone who can't speak your language. And that takes a lot of check-ins and a lot of movements through that algorithm. With food, so let's say I change the diet. This is not an elimination problem, but I have a pica cat. Pica is where, as you know, probably, but some of your listeners may not know, it's where animals eat things that are not food. And so this cat has already been obstructed once and had a foreign body surgery. So cut the body open, cut the gut open, take it out. So for this cat, when I changed the food, we waited a month for something to happen, right? And I generally will wait a month for foods. For supplements and medicines, a lot of the time we'll wait 6 weeks. Some cases, people walk into my exam room and they are transparent, which I appreciate, and they say, "This has to be fixed in 2 weeks or I will relinquish this cat to the shelter." Or they'll say, I'm a renter. This cannot continue," right? So for those cats, we may use very fast acting medicines, medicines that work in an hour or two, but those medicines have to be given 2 to 3 times a day. And I don't know a lot of cats that like to take medicine. So if we use those short term medicines, we still have a goal of getting the cat on a longer acting medicine so that people can give a medicine once a day.
Mm. So I'll just ask one more question and then we'll wrap up because we're already over time. But so you said we're gonna wait. We have to see how things go, and um, I hope people realize that that is a scientific approach, right? Like we're not being like, oh, we don't know if this is gonna work. Every cat is individual, and we know what might work, but we have to observe. We make these changes and we have to observe. So that is the scientific way to approach it, and that's a very reasonable way to do it. But in the meantime, your cat's peeing outside the litter box. Do you have any practical advice for cleaning that up or dealing with that or mitigating that in any way while we're waiting for some of these things to help
Yeah.
our cats in
The
the long
best
term?
thing that you can do for your cat is to look at your litter box environment and make sure it's right. That is the number one best thing that you can do. In the meantime, your cat may have chosen a location or a substrate. Substrate is what we're going to call the surface the cat is using for urination or defecation. Remove that, block that, close doors. If your cat's going on your bed, close the door to your bedroom. If your cat is going to the bathroom on rugs, pick those up, right? Towels, put them in the hamper. So as much as you can, you're going to like restrict access, right? You can take your couch and if you have dogs, you have baby gates. So you can put baby gates on the couch. Most cats do not jump on a couch with baby gates on it. Obviously, you take them off when you're sitting on it, but you block that area. One of my clients just covered her couch in plastic. She was like, until we get this settled, I got a plastic couch cover like you see, on Everybody Loves Raymond. The mom has one of those. She just got one of those. She's like, I'm good. Whatever you can do to block it is what you should be doing. And also, what you shouldn't be doing is acting like a fool yourself. Don't be yelling and squirting cats and shaking cans and putting electrified things on your couch. Just settle the heck down because every time that you act out, you just make it worse. Your cat is already freaking out about something. You acting like a fool is not going to help. Okay. So cover it, block it, pick it up, clean it up, and then get your cat to the vet.
Such good advice. Such good advice. Awesome. Thank you so much. I appreciate you stopping by. And I learned things. So I hope everybody else did too.
Awesome.
Thank
Thank
you.
you for having me. We're helping some kitties today.
Yay. Thank you for listening to the Enlightened Pet Behavior Podcast. I hope you and your beloved pets have found valuable insights for a more harmonious life together. Please remember that this podcast provides educational information only and is not a substitute for professional veterinary or behavioral advice. If you need personalized support, please don't hesitate to contact me and we can explore how we can work together to achieve your pet behavior goals. You can reach me at enlightenedpetbehavior.com or via email at susan@enlightenedpetbehavior.com. This episode was edited by Monty Light. Special thanks to Mac Light for composing the podcast's music. You can find him at maclightsongwriter.com. Treasure those fur babies, and I'll talk to you next time.